Hello and welcome to another edition of Heart of Healthcare. My name is Dr. Jan Bonifer, and these podcasts are about helping physicians restore balance in their lives so we can recreate a medical system that benefits everyone. A quick reminder that you can find more information about our nonprofit heart-based medicine and the work we do to support healthcare professionals at heartbasedmedicine.org.
Welcome to the Heart of Healthcare podcast, Series 1, Episode 3. Should healthcare professionals follow their intuition more?
There's a quote by William Osler which says, "Listen to the patient. He is telling you the diagnosis." Is there any room for the truth in this statement within medicine today? And should we be paying more attention to our own knowledge and intuition than that of our patients? In my experience, when we view the patient as a partner in their own healthcare, the dynamic between us changes, bringing forth knowledge and intuition from both sides. I'm curious to learn about our guests' understanding and intuition and how they incorporate it in their practice. So welcome back again, Professor Kavita Chinayan and Dr. Daniel Dinenberg. Yay!
Thank you so much, Jan. It's such a honor and privilege to be here again. Hi, Kavita. Wonderful to be here.
Yeah, thank you, Jan. And it's wonderful to be here with you and with Dan. Thank you.
So let's dive into this. We've all been thinking about this for a while now. And we have already had very vivid conversations about this. So this is about the role of intuition. And so let me start with this question of the patient. So patients often have deep insights into their own complaints, if only doctors would take them into account. So what would encourage more profound sharing of the patients? We have learned history taking, and we've been there's a drill around this in how you take a patient's history.
I mean, it's such a good question, Jan, because I think ultimately, as we were discussing before in the training of us as clinicians, we are recognizing patterns. We're taught to diagnose and to treat, but we're not really understanding the human element behind that. And so that's something that we were discussing before. And so now what you're pushing us to really try to figure out is, hey, what is the patient's role in their own imbalance? What is the patient's role in these deep insights that you talked about in sort of uncovering that? And what that really requires is time and space. And I think that what you're talking about is really interesting in sort of the pattern recognition. Very quickly, in a modern conventional practice, you get this sense of how quickly a doctor is interrupting the patient to quickly steer them back to their own agenda, which is like, okay, let's try to figure out exactly like you said with the pattern recognition. Okay, what is this? Is this a viral upper respiratory thing? Is this a kidney thing? And we're kind of putting it into these ways, compartmentalizing for us to understand. And so we're not sitting with spaciousness and allowing the patient the deep insights for them to let us know. And I think what happens there is what we end up with at the end of the day is maybe the physical manifestations of what's really going on, or almost like imagine sort of, I love that image of the iceberg coming out of the water and you don't really see what's really going on beneath the surface. And so what we see is, those are the clues that we're given. Those are the clues is just what we're brought to the table of, hey, this is what's going on. I'm having itching or I'm having this cough. But beyond that, what's happening underneath? And that requires deep listening. That requires presence. That requires a relationship about co-creation. But ultimately, what that comes down to is the provider, the clinician, having the time and space in which to enter into this sacred connection with another human being to try to uncover what's really going on. And so what you're ultimately creating here is those of us that manage to do it in a very busy practice are somehow managing and evolving to do it on our own. But the training and the way that we're set up and the interaction that exists isn't set up to do that. It's not set up in a way to create that experience. So when it happens, it's a magical thing that's happening, but it's not geared towards that.
Mm-hmm.
Yeah. Is this your experience as well, Kavita?
Yes, it is. And, when we think about intuition, right, it is, in other words, it is an embodied sense. That's what it is. And intuition is an embodied sense about something which is pre-verbal, right? We don't have the language yet to express something that is so deeply embodied, and it is, you can say it's a primal thing, intuition. And in general, what has happened, over, centuries and evolution is that the intellect has developed at such a great speed, in humans, is that it kind of obscures and masks that primal thing, which is this pre-verbal embodied sense about something. And this kind of intellectualization is really revered and worshipped in medicine, because it is this intellectualization that makes us, pursue this field of knowledge, right? Which is everything we do is in that field of the intellect, which is the reason. And whether we are talking about clinical trials that show this, and this, or, what we have learned in our training and so on, it is all really honing the intellect. And we haven't really been taught to, dip into that primal, pre-verbal, embodied sense of something, which is the intuition. And the more that we are in touch with our own intuition about things, the more we develop that about ourselves, the more we can actually open to other people and their intuition. We can't be really these highly developed intellectualization based people, and all of a sudden we've never developed it, we've never really honed into our own intuition, and all of a sudden it's not going to be possible to walk into a patient's room and listen to what they're saying. It only happens if we train ourselves first with ourselves, right? It has to do with that. And the Eastern traditions, when you look at some of the Eastern traditions that really emphasize communication in a way where you are listening in an embodied way to somebody else, and that becomes your stance. And that really does take a lot of practice, because you have to get out of your head and become embodied, somewhere else, right? You have to quite literally become heart-based. So you have to drop into the heart and feel into things, which has nothing to do with your reasoning ability and your intellect or your thinking ability. And the more we cultivate that, right, in our moment-to-moment awareness, we become available for other people and learn to think in a different way, which has less to do with the reasoning and more to do with this embodied pre-verbal sense.
And that is so amazing. So that is what you experience as a senior physician. You experience, about the value as a professional, about the medical value this has for yourself and for your patients. While at school, in medical school, this has been systematically drummed out of us as not scientific, not objective, and interfering with. So would you say that well, guys, too bad, so sad, but that's part of learning is first, you have to really learn to discipline your mind in a scholarly way. And by the time you've done this for 6 years, and by the time you've done your 6 years of residency, and you've learned to apply this rigorously, no exemptions, then you're allowed to kind of start dancing, then you're allowed to kind of bring that in, or are we actually depriving ourselves of a skill that we could acquire much earlier?
Well, I'd be very interested to see what Dan says about this, but I don't think this starts in med school. This starts in childhood. I think this is something that the whole society is really based on reason and intellect. And it's not, you think about how we treat people who are, who say they are intuitive, or they say they're empaths or whatever, and we kind of treat them like who is this odd person out, right? Because we as a society, we don't appreciate that, and we kind of think these people are outliers, and so it's something that happens right from childhood. And I think those of us who are intellectually really very curious and kind of in that line, just, are attracted to certain professions. So I don't think it's med school that drums these things out of us. I think it is society. And I also don't think that this is something that we say, okay, first cultivate your intellect and then do this. I think it needs to be simultaneous, and for our own sake, actually, and as a result of our own development, that then spills over into patient care.
Yeah, so this is something that starts much earlier, and it applies for both the healthcare professional as well as the patient. Dan, how do you see this? So how do you, as a holistic practitioner, of holistic medicine, how do you empower the patient so that we elicit a more profound sharing? Because they've also been conditioned into what to tell the doctor so the doctor is happy and arrives. So it's like a co-conditioning that we have, that both parties have gone through. What do you do to help patients to really dive deeper?
Well, in that same way that, Jan, you're talking about the co-conditioning, it is an ebb and a flow. It is a movement of energy it's the relationship between the physician and the patient, and they model exactly what's going on. So if I'm asking very quick questions that are not open-ended and I'm trying to get to an answer, they're going to start giving me those answers. And so very quickly, you're going down a very quick path of trying to figure that out. I love the idea of the dance, because when you guys are talking about that, it's like, do you learn all of the steps and then figure out how to put it together? No, you need to do it simultaneously. Kavita, I love the way that you're expressing that, because ultimately, as we're evolving, we realize we need to anchor into that point. Like I see all of this coming together, and you could see the dimensions of how it all works together. And that helps you. Then you can go deeper into the science. You could go, so you're playing in the micro and the macro. You go in and learn the biochemistry, but you're understanding that it's about energy and it's about metabolism and it's about the way that a person eats and how they get energy out of that. And so one of the things that I think is really important to bring up right now is that we have been in an area where we have been focused on the intellect, and this is exactly the conditioning we're talking about. We're choosing those people that do very well on tests and we're moving them along. And so we're very, very obviously, choosing, quote unquote, those odd outliers and not allowing them into medicine, even though that's what we need more than anything. One of the places that we are right now, which I think is an interesting concept, is the intellect and the ability to look at patterns is getting pushed in an incredible way in technology. We're seeing machine learning and artificial intelligence as a way of looking at patterns. And so now we're seeing things that we've never thought possible. All of us were like, honored to be like, oh, you memorized Harrison's? Wow, you're an amazing internal medicine doctor. But ultimately, every computer, even our phones now have the capacity to take all of that information. And so where are we left? Where are we left as these professionals that bridge the emotions, the mental, the spiritual, the physical aspects of our patients into something that is ultimately profound, which is a healing journey?
Fantastic.
And so that becomes such an integral part of where we need to go, because ultimately we need to evolve, because computers are going to be able to identify pathology or look at dermatology. You give them enough pictures and it could probably look at, going back to the idea of pattern recognition, if that's what we're being paid for and that's what we're bringing up, and now we have a better way of pattern recognition, we're going to be out of work. But what is left there, I have no concern for where we're going, because what happens is tapping into the heart, that is actually a human superpower, to be able to take that information and then put it in terms of what we are feeling and what is intuitively going on with the patient themselves. That is what is the art of medicine. That is what we are now being understood, or we really should be trained for in this deeper sense. Very roundabout way, Jan, getting back to your actual question, which is, how do you create that environment? So if I come in and I create sort of an out-of-the-box experience, or someone all of a sudden is not, it's already, the experience is, even if I'm meeting them in the waiting room instead of the nurse or someone else, and I'm asking real questions about their life, all of a sudden you're creating a dynamic. You're creating a very different way. And then all of a sudden we model intuition and share our vulnerability and say, hey, look, when you explain that, this is what came up for me. And so now you're coaching them and allowing them to understand how to tap into their intuition, to understand that that's the insights. What's going on? These are what you explain. This is sort of the tip of the iceberg. This is what you're explaining. What's going on beneath them, and give them time and space. And ultimately, when we do that, we encourage more profound sharing. We encourage the deeper connection and the relationship. And ultimately, then they're like, maybe it has something to do with my recent divorce or my recent loss or my grief and then they bring that up. And that's an incredible facilitated journey together.
That is really important. And I think so. Let me take both of these kind of two elements together, Dan. What you were highlighting is that computers do some things that doctors have been praised for much better than doctors do right now. So for example, data processing, data mining, text mining, information sourcing. That is something that already can be provided by computers much better. There are robots now that are actually kind of emulating a compassionate behavior. But the interesting thing is that it's a little bit like what we've been trained in the communication classes. It's a little bit like, oh, hello, Mrs. So-and-so. What brings you to hospital today? Okay, open-ended question. Okay, start with an open-ended question. But everybody knows that this is a rhetoric. It's a little bit like in the restaurant. How was your meal today? So it looks like an interested question, a truly interested question, while it is kind of a learned articulation of something. So we can realize, we immediately sense whether something is an action or is words that sound like compassion or sound like truly interested, but they're not actually. So it's not so much about what we say and what we do and what we memorize, but it's kind of how we interpret that information and how we interact, and from what place inside we connect with the patient. I think that's what I hear from you. That is kind of what you call the human superpower. And Kavita has alluded to that as well by saying this is actually this almost like, this is a diagnostic tool. Kind of we can we can learn by learning to sense in an embodied way. We can actually appreciate something in ourselves. So we become like a diagnostic device. But that requires the willingness to really learn and go into this. So this is part of the dance then. So what does it take? So we looked at the patient and how can we help and kind of empower the patient. So let's look at our part. So what is it? What I hear from you is that what can we do so that we allow ourselves and we have the courage to tap into our own intuition and bring that to the table? And how could actually tapping into our own embodied experience, how could that actually help us understand the patient better beyond what we've learned from a pattern recognition and knowledge processing point of view?
I think it really has to do with listening.
Yeah.
That's the first step, right? And paying attention to what is not being said.
Mm-hmm.
Because we focus so much on what is being said that we kind of, don't notice how somebody is saying something, their body language, and what is being held back, and there are a couple things to this. One is experience. The more you practice medicine, the more you become honed in to what is not being said. And I have noticed this actually even amongst my partners and colleagues. The great physicians, right, are the ones that don't really do this pattern recognition thing. They do that, but it's really something else. And this has happened to me many times where, trainees will question me and say, why are you ordering this test? Or why are you doing this? And I say, I don't know, something about this story is not fitting. And I think there is something more to this, right? And it turns out to be that. And I have learned this actually from my teachers who, my preceptors, who really did this well. And they were great physicians, right? And who kind of learned to listen to the unsaid, that there is more to this than what is being said. And I particularly see this in women. And heart disease is a problem in women. And when we look at, for instance, because I'm a cardiologist, I can speak about heart disease. And a lot of the symptoms that women present with in heart disease tend to not be the same as men. But we don't have a standard for women because women in society and in medicine are judged by the male standards. We don't even have like an understanding of what heart disease in women should be like, what it's like, because we don't have a standard other than the male standard, right? And so there are many situations where women, come to me, for instance, or to other women doctors and say, I have been to 4 other cardiologists and they haven't been able to figure out what is wrong with me. And I'm telling you, I feel like something's wrong with me. And I believe them. I'm like, you're right. If you feel that is the case, I'm going to believe you. So first, listening. The second thing is believing what the patient is telling you, because until we believe that, the words of, the quote you were open this with is not going to become true. The patient is telling you their diagnosis, but if you don't believe it, what's going to happen, right? And it's really modeling that intuitive stance, so that even if you don't actually have it, you can at least be open and allow, that communication to take you where it needs to go.
And Kavita, luckily, more and more women are actually allowed and are coming into the healthcare professions at all levels.
Yes.
And would you see that this will change the way that we're practicing medicine? Will this change? Will this bring a change in how we integrate intuition in our medical practice?
I want to say yes, but how are women being trained and by who?
Mm-hmm.
And, are we allowing women to be themselves, or are we drumming out the femaleness from women and have them be and act like men? And I've seen this in a lot of young women who come into medicine is, it's like, hey, where's your uniqueness? Because they are thinking and behaving and acting the way they've been taught by the men, right? And so they have left aside and they have completely masked their own femininity at the cost of, in order to be accepted into mainstream medicine. And so that's not going to work, right? So women should be encouraged to be who they are and bring their exceptional gifts that are different from the male gifts, and be encouraged for their own uniqueness rather than drum out the femaleness out of them.
So what is required, Dan? What could you see? What could you see as a system change, a change at the system level, so that we develop an intuitive form of medical practice that really embraces and builds on, learns from the female intuitive, or the feminine, maybe rather the kind of the principle of femininity, that to learn from the feminine quality of tapping into intuition, that ability.
It's such a beautiful concept. Even saying it out loud, Kavita, when you were speaking, I actually had chills, because it's exactly what we're in the middle of right now. We have come from, ultimately a paternalistic system in medicine in the way that the training has been. And that's exactly why even, young women entering in, but have been trained and imbued with a certain kind of masculine energy. And so what you really need to do is you need to go back and bring in from the very beginning the balance between the masculine and the feminine, and really helping to create that as something we're looking for when we're looking for applicants in medicine. And so I think that ultimately, many people, get extremely good grades, but they also play a sport and they also volunteer. But if you really ask physicians that have been through it, they're very, very academically driven. And then they are so good at what they're doing that they put these other things, I need to volunteer an extra 24 hours here and there. And they're kind of like putting their CV or their resume together in a way that looks like they're well-rounded. But we're not actually taking and hoping for the people that are actually bringing in this balance and bringing in this intuition at a very early age. And so I think when you look at a systematic change, and we're looking at a change we're no longer looking for just the smartest and the best pattern recognizers and the most intellectually intense human beings on the planet, but those that could empathize and have compassion and have love and can be caring and can hold that while being academic. And so that ability, it's like when we look at neuroplasticity and the ability to hold these two things, we're developing new pathways. And so in some ways, we're actually looking for people with heart that are living in a heartful way, that then are creating patterning between their heart and their brain. And so that is ultimately what, if I'm looking at a new applicant, someone that can hold and can have all of that and be the very best physician, healer, that is who we're looking for. And when you have that, then we're going to change the whole system, because that's who we're looking for. And that's where more people are going to enter into the practice. And that's going to model it for our patients to become more intuitive and share themselves. And then healing will occur.
Wow. Well said, sir. Thank you. Wow. This has been already, again, a beautiful deep dive together, exploring the questions around intuition and what might be a path forward beyond being stuck in our gender roles, gender limitations, and actually stepping out of our current way of thinking. So thanks a lot for being on the show today. And we're really looking forward to a next episode together. I hope you enjoyed the chat with Kavita and Dan, and you can find more information at heartbasedmedicine.org. And I'd deeply appreciate if you could click subscribe on whatever platform you're listening to this podcast on. Until next time, thanks for listening and take care.
This has been a Heart-Based Medicine production. Thanks for listening.